Phlebotomy test study plan. Question 1. A phlebotomist notices petechiae on a patient's arm. This may indicate option A, abnormal finding, option B, fragile capillaries or platelet disorder, option C, allergic reaction to tourniquet, option D, dehydration. The correct answer is option B, fragile capillaries or platelet disorder. Petechiae, small pinpoint hemorrhages under the skin, indicate capillary fragility, thrombocytopenia, or platelet dysfunction. They can also appear when a tourniquet is applied too tightly or for too long. The finding must be documented and the phlebotomist should proceed with caution. Question 2. Which tube is used for lipid panel? Option A, red or serum separator, option B, light blue, option C, lavender, option D, gray. The correct answer is option A, red or serum separator. Lipid panels are performed on serum or plasma, making red top or serum separator tubes, SSD, the standard collection tubes. Light blue tubes are reserved for coagulation studies, and gray tubes are for glucose-related testing. Question 3. Phlebotomy should not be performed on option A, arm with fore, option B, non-dominant arm, option C, forearm vein, option D, hand vein. The correct answer is option A, arm with fore. Venipuncture should be avoided on an arm with an active fore line because fluids dilute the sample and compromise test accuracy. The non-dominant arm, forearm veins, and hand veins are all acceptable collection sites under appropriate circumstances. Question 4. Which action may cause hemolysis? Option A, gentle inversion, option B, vigorous shaking, option C, correct needle gauge, option D, proper tourniquet placement. The correct answer is option B, vigorous shaking. Vigorous shaking creates mechanical shear forces that rupture RBC membranes, releasing hemoglobin and intracellular contents into the plasma. Gentle inversion, not shaking, is the correct mixing method. Tubes should never be vortexed or shaken. Question 5. Which is a sign of infection at venipuncture site? Option A, swelling, redness, warmth. Option B, bruising only. Option C, slight discomfort. Option D, temporary pallor. The correct answer is option A, swelling, redness, warmth. Classic signs of localized infection: swelling, tumor, redness, rubber, warmth, calor, and pain, dolor, at the venipuncture site indicate an inflammatory or infectious process requiring prompt medical attention. Bruising and temporary pallor are common non-infectious responses. Question 6. Which action is correct if a patient experiences syncope? Option A, lower patient to supine. Option B, leave patient standing. Option C, continue venipuncture. Option D, apply tourniquet tighter. The correct answer is option A, lower patient to supine. Syncope requires immediate needle removal and lowering the patient to a supine, flat, position to restore cerebral blood flow. Leaving the patient standing or continuing the draw risks serious fall injury and worsens the vasovagal episode. Question 7. Capillary blood differs from venous blood because it, option A, has more oxygen, option B, mixes arterial, venous, and tissue fluid, option C, clots faster, option D, is less suitable for glucose. The correct answer is option B, mixes arterial, venous, and tissue fluid. Capillary blood is a mixture of arterial blood, venous blood, and interstitial and intracellular fluid from the punctured tissue, making its composition slightly different from pure venous blood. This is clinically relevant when comparing capillary versus venous reference ranges. Question 8. Icteric specimens are caused by option F, high lipids, option B, high bilirubin, option C, low glucose, option D, high potassium. The correct answer is option B, high bilirubin. Icterus refers to the yellow-orange discoloration of serum or plasma caused by elevated bilirubin levels, seen in conditions such as liver disease and hemolytic anemia. This is distinct from lipemia, milky appearance, and hemolysis, pink-red discoloration. Question 9. The most common complication of venipuncture is option F, infection, option B, anemia, option C, hematoma, Option D, syncope. The correct answer is option C, hematoma. Hematoma formation, caused by blood leaking into surrounding tissue, is the most frequent complication of venipuncture. It typically results from improper needle placement, premature needle withdrawal, or insufficient post-draw pressure. Question 10. Which represents the correct order of draw? Option A, red, green, lavender. Option B, lavender, red, light blue. Option C, light blue, red, green. Option D, green, light blue, red. The correct answer is option C, light blue, red, green. The CLSI recommended order of draw is blood cultures, light blue, citrate, red/SST, green, heparin, lavender, EDTA, gray. Light blue must precede red to prevent clot activator carryover, and EDTA tubes come after heparin to avoid potassium contamination. Question 11. What is the purpose of antiseptic in phlebotomy? Option A, stop bleeding. Option B, prevent infection. Option C, mix sample. Option D, stimulate vein. The correct answer is option B, prevent infection. Antiseptics reduce the microbial burden on the skin surface prior to needle insertion, preventing introduction of bacteria into the bloodstream, bacteremia, or contamination of the specimen. They must be allowed to dry completely before puncture for full efficacy. Question 12. Which tube is typically used for glucose testing? Option A, light blue. Option B, gray. Option C, lavender. Option D, red. The correct answer is option B, gray. Gray top tubes contain sodium fluoride, which inhibits glycolysis and stabilizes glucose concentrations for up to 24 hours at room temperature. Without a glycolytic inhibitor, glucose levels drop rapidly as red blood cells continue metabolizing glucose in the sample. Question 13. If a tube is underfilled, test results may be option A, accurate. Option B, vaulted due to additive ratio imbalance. Option C, unaffected. Option D, faster to process. The correct answer is option B, altered due to additive ratio imbalance. Underfilling alters the ratio of blood to additive, particularly critical in citrate tubes where excess citrate causes falsely prolonged patient/PTT. Proper fill volumes are calibrated by the manufacturer and must be achieved for valid results. Question 14. Which of the following stops blood clotting by inhibiting thrombin? Option A, oxalate. Option B, EDTA. Option C, heparin. Option D, citrate. The correct answer is option C, heparin. Heparin inhibits coagulation by potentiating antithrombin 3, which inactivates thrombin and factors A. This distinguishes it from EDTA and citrate, which both work by chelating calcium, and from oxalate, which also chelates calcium but is rarely used in modern practice. Question 15. What is a common use of fingerstick blood? Option A, CBC. Option B, blood glucose. Option C, blood culture. Option D, coagulation studies. The correct answer is option B, blood glucose. Point-of-care blood glucose monitoring is the most common clinical use of fingerstick capillary blood. Blood cultures require sterile venous samples, coagulation studies need precise venous volumes, and while CBC can be done on capillary blood, it is not the most common fingerstick use. Question 16. When a specimen label differs from ID band, phlebotomist should option A, draw anyway. Option B, correct on computer later. Option C, re-verify patient and relabel. Option D, ask another phlebotomist. The correct answer is option C, re-verify patient and relabel. Any discrepancy between the specimen label and the patient's ID band must be resolved before collection by re-verifying the patient's identity using two independent identifiers. Drawing without resolving the discrepancy is a critical patient safety error. Question 17. For proper specimen identification, labels should include option A, patient name, ID number, date/time. Option B, only patient name. Option C, only date. Option D, only test type. The correct answer is option A, patient name, ID number, date/time. Complete specimen labeling requires at minimum the patient's full name, unique identifier, medical record number or DOB, date and time of collection, and collector initials. Incomplete labeling is a critical error that can result in specimen rejection or patient misidentification. Question 18. How should a specimen for bilirubin be protected? Option F, light-sensitive container. Option B, room light. Option C, refrigerate only. Option D, freeze immediately. The correct answer is option A, light-sensitive container. Bilirubin is photosensitive and degrades rapidly when exposed to light, particularly UV. Specimens must be transported and stored in amber or foil-wrapped containers to prevent falsely low bilirubin results. Refrigeration alone without light protection is insufficient. Question 19. What is the first action after a needle stick injury? Option A, finish the draw. Option B, wash the area with soap and water. Option C, ignore it. Option D, put on gloves. The correct answer is option B, wash the area with soap and water. Immediate washing of the puncture site with soap and water is the first and most critical step following a needle stick injury to reduce microbial load. The incident must then be reported immediately to the supervisor and occupational health per facility and OSHA protocols. Question 20. Airborne pathogens require what level of precaution? Option A, contact. Option B, droplet. Option C, airborne isolation. Option D, standard only. The correct answer is option C, airborne isolation. Airborne isolation precautions are required for pathogens like Mycobacterium tuberculosis, measles, and varicella that are transmitted via small particle aerosols. This requires N95 respirators and negative pressure isolation rooms, a higher level than droplet or standard precautions.